How often do you look to include resistance training or a form of this in a rehabilitation process?
I see about 8 patients a day, and we try to incorporate resistance training with basically everyone. Um, so we see people from like total knee replacements and um, rotator cuff tears and all that stuff. And even if they're fresh out of surgery, we try to do some resistance training for them because down the line it's going to help their recovery.
Okay, and I guess if you can name a few ways that you would include resistance training without actually using free weights, because I know free weights is kind of overbearing sometimes, especially with people fresh out of surgery. You wouldn't want to, have them using free weights. So, what are some ways that you can include resistance training without using these weights?
Body weights, or like the weight of your body to do
Mhm.
exercises, um, like squats, lunges. Those are functional movements that we use in everyday life. Um, so squats, that that changes, your resistance as you go through the motion. And
Mhm.
the lunge too. Also, planks are a favorite that we do a lot at the clinic. Those are our favorite core workouts because it goes core from the top of your shoulders to your hips. So that whole core down the middle is a good workout. And also yoga poses we do a lot, like bird dog, downward dog, and stuff like that. We use that for the back, for back patients, and just to increase core strength and stability.
The third question is going to be our last question. Say a patient is in rehab and needs to build muscle strength, but doesn't have the strength at the time to perform any resistance training. What would you look to do to ensure that they still advance in the rehab process?
First, we would start with isometric exercises. So we do that a lot with our total knee replacements, like I said. But we do this with all post-surgical patients, but I'll just give you an example of a total knee replacement. We would have them, laying on the treatment table and tell them to squeeze the back of their knee into the table to kind of extend their knee into the table like that, because that helps the quad muscle, which is usually doesn't work after total knee because they use a nerve block for the surgery. So we usually try to work that quad muscle first, but obviously we're not going to use free weights like you said. So we just work small movements like that. Make sure they squeeze their quad so they get their knee into the table, and that really works the quad a lot. You would be surprised in those patients, like their quad is shaking, they can barely do it sometimes. But that's where we start first, and then later on we do like short arc quads and long arc quads, and then we add resistance bands and stuff like that, where they extend their knee into the resistance band, and then they start doing other things with weights and stuff like that.
Cool. Well, I guess I'll conclude this interview. I thank you for taking the time to answer these questions, and good luck with your patients. And hopefully, they all see recovery in the rehab process.
You're welcome. Thank you.